We have another question, this time from Jerry.
Lenny, I have a question for you. Did you say I should talk to my son about suicide? Look, I'm afraid to bring up suicide. It's going to plant the idea in his head. Isn't it better if I don't say anything at all?
Well, no. Unfortunately, a lot of people get confused by this. Just like you would want to talk about drug or alcohol use with your son, it's really important to address the issues of suicide. It's a myth that talking about suicide can plant the idea in someone's mind. Kids hear about suicide from a variety of sources. This is nothing new to them. And in fact, talking about it can be a real relief.
Great. Thanks for your help.
Who do we have next?
Hi, Lenny and Maureen. I'm Juan.
Hi, Juan.
My question is for Maureen. Are suicidal thoughts a normal part of being a teenager?
That's an interesting question, Juan. Many teens will acknowledge that they've had a suicidal thought at one time or another. Thinking that life isn't worth living, though, or that you'd rather be dead is disturbing, especially in adolescence. And if you get any hint that your child may be having these thoughts, it's essential that you ask about them. For many kids, thoughts about dying remain just that, simply thoughts. In a small percentage of kids, however, these thoughts may be accompanied by a plan. That's an extremely dangerous sign that requires immediate intervention. And again, that's why it's so important to ask your child about suicide if you have even the slightest reason for concern. I hope that answers your question, Juan. I believe Karen is next.
Yes. Hi, Maureen. A classmate of my son recently did take his own life.
Oh, Karen, I'm sorry to hear about that.
Thank you. He and my son were on the same soccer team, and I'm worried about my son, but I don't know what to say or do.
Well, I can understand the reason for your concern, Karen. What you're talking about is an example of what's called exposure. That's the risk that comes from being exposed to the death of a peer or even the death of a role model. The first thing you should do is talk to your son about his classmate's death.
Oh, that's tough. I wouldn't even know how to start.
Well, try this. Open the door of conversation by telling him how you feel about his classmate's death, and then ask him how he feels. Don't be surprised if he tells you he doesn't know or he has no reaction at all. It can be hard for teens, even for us grown-ups, to find words to adequately capture the feelings of grief. Remind your son that there is always an alternative to suicide. Encourage him to talk to you if he gets worried about his own thoughts or feelings, or even if he's concerned about one of his friends. And find ways to revisit this conversation, because feelings about a friend's suicide really may take a while to settle. They just don't go away quickly.
Great advice, Maureen. Who do we have next?
Hey, Lanny. George here. My daughter Samantha's school counselor suggested I take her to get some mental health counseling. Apparently, she made some comment about life being too hard or complicated or something like that. I'm not even sure exactly what she said. Isn't the counselor overreacting?
Usually, counselors give that kind of advice based on professional experience. This recommendation was most likely developed in response to concerns from Samantha's teachers or a conversation the counselor had with Samantha herself. The first thing I recommend you do is talk to the counselor to find out why she's concerned. Try not to be defensive. Remember, the school is obviously concerned that something you may not be aware of is going on with Samantha, and they think she needs some professional help. It's important for you to understand why the counselor is making this referral, because you'll need this information when you speak with a mental health professional. Most mental health agencies will have releases you can sign that give them permission to talk with the school directly. The school's input can be critical to make sure that Samantha gets the services she needs.
Lanny, Maureen, I'm Michelle, and my son has a drinking problem and is depressed. His doctor prescribed medication for him. Why would you give drugs to someone who has a problem with an addiction?
I can understand your concern, Michelle, but a prescribed antidepressant medication, which I assume is what your doctor recommended?
Yes, you're right. That's what it is.
Well, that's really different from street drugs or alcohol. Prescribed medications are not designed to create the feeling of being high. They're designed to help address your son's symptoms of depression and help him function normally.
Look, I know you're the experts, but I read that antidepressant medication can cause kids to become suicidal. Why in the world would my son's doctor prescribe it for him?
That's a great question, Michelle, because it's been in the press a lot lately. You're right. There's some research that shows a small percentage of youth had thoughts about suicide, and some made attempts when on the medication. But for a much larger percentage of kids, the medication was helpful. Those kids had at least moderate to severe depression. For kids with milder depression, the drug benefits may not outweigh their risks.
That's right. So that's why, Michelle, it's important for you and your physician to carefully monitor your son's behavior as the medication is being introduced and with any adjustments that may happen later on. Learn about the ways in which medication helps and the warning signs of potentially harmful side effects. It's also important to encourage your son to tell you if he experiences anything out of the ordinary on the medication. And if he does, you should contact your physician immediately. And finally, find a good counselor or therapist with experience in cognitive behavioral therapy. This counselor can address the issues that led to your child's depression in the first place.
Thanks. That helps me understand it better.
Lauren, I think you're next.
Hi, Maureen.
Hi.
My daughter Christine got a text message from a friend saying she's thinking about taking her life. Christine asked me for advice, and I was clueless. Can you help me?
Sure. The first thing I would say to you is to tell Christine how glad you are that she came to you for help. And then the next thing is to tell her that you'll take care of it from here. After that, I think what you want to do is pick up the phone and contact this girl's parents to let them know what's going on. Wouldn't you want to be called if it was Christine sending the messages?
Yeah, you're right, I would. But what do I say to them?
Lanny, what do you think?
If it were me, I would say, Christine got a disturbing text message from your daughter about taking her life. And I thought it was important that you know so that you can talk to your daughter about it.
That's great advice, Lanny. And in doing this, Lauren, I think the other thing you're doing is showing Christine that you really are there for her when she's facing difficult situations. Our next question is from Todd. Todd.
This is for Lanny. My son just graduated high school and is going away to college. He had problems with anxiety in high school, and I'm worried about his transition to college. Is there anything I can do to make it easier for him?
It's important that you're thinking about these things ahead of time, Todd. College counselors have told us that one of the biggest problems they face is when parents and incoming students see college as a new beginning and want to forget about their previous mental health history. These families tend to minimize the fact that the transition to college itself is stressful. And for vulnerable students in particular, it will bring up some of the same old feelings and issues that challenged them in the past. Students with depression, anxiety, suicidal ideation, or past suicide attempts, or even a recent history of loss in the family, present a higher risk. So, before going off to college, it's important to talk to your son about campus and community mental health resources. Having that information beforehand may help your son and you feel more comfortable that support is available and accessible to him to help in this transition.